CU Health is doing the very best it can to lead the way in health and wellbeing of employees. And I've learnt over the last couple of years the really taxing environment that strata managers work within, and that wellbeing is becoming an absolute priority to stabilise the sector, reduce risk within the sector, and also to just continue performing adequately. Chris, I might throw to you as someone who's obviously very experienced in the sector, like the other gentleman on the call. What do you think about wellbeing in the strata sector? How does it manifest as an issue, and what have you seen over the last decade with regard to employee wellbeing?
Yeah, thanks, Pat. Look, the strata, I think every job and every industry exists on a spectrum of, high exposure to potential psychological risk, and the strata industry, unfortunately, is right up that high end of the spectrum. I could wax lyrical on the reasons why, but just take my word for it. We send our team day in, day out into scenarios and circumstances where they are at genuine risk of psychological injury. So we see it manifest in burnout. Really great, talented people who we desperately want to keep in the industry leave at a rate that I don't think any of us would be satisfied with. But it's upstream of that. Frankly, it prevents people from wanting to come into the industry in the first place. And we've got a real crisis in the strata industry to make the conditions more attractive for talented professionals. And I think we've got a lot of work to do in order to create the conditions that result in that, frankly.
Thanks, Chris. What I'll go to John now. John, what's your experience? Do you see it the same way as Chris? How are things different state by state? I know you share a lot of information together, or is it an industry-wide phenomenon?
I absolutely agree with that. I think it is industry-wide. We're in the complaints management and handling business. There's ever-increasing pressures on the team to deliver outcomes for the clients in an unrealistic time manner. Just the pressures and demands on the team are never-ending. Any support we can provide there obviously deals in that lack of reduction in the burnout end, and obviously staff retention, longer relationships with the clients also results in better client retention and ultimate performance of the business as well.
Okay, it's really it's just really interesting and I suppose reassuring for me that sort of leading CU Health to hear that there is a problem a genuine problem that we can help solve. Tim, you've partnered with CU Health for a while. I guess pre-CU Health and afterwards, what do you feel as though it's brought to the team with respect to the things that Chris and John have raised?
Yeah, well, I guess the things that John and Chris raised, that were 100% apparent before we partnered with CU Health, and they still are to a degree. But we're finding that the partnership with CU Health has led to, I guess, a more comfortable arrangement where the staff know they're supported through not only that measure but a few other initiatives that we as a company and the wider strata community are starting to put to our teams. It is one of the things that is really high on my company's agenda, to take care of my staff. That's the paramount sort of initiative that we've done over the last couple of years. And, the partnership with CU Health has only enhanced that. As I said before, the staff feel supported. There's an outlet and an independent, outlet for them to, have a chat with someone about, any stresses and that's not only in the workplace, but also anything they're going through personally that also helps them to perform at their best in the workplace. And since we partnered with CU Health, we put it on our Seek recruitment ads that we offer this to our people. It's a topic that actually gets raised in interviews that I do with people for potential recruits. They really appreciate the fact that we're a forward-thinking business that has chosen to partner with CU Health, and it create an environment that is one that they can feel comfortable working in.
Yeah, that's really interesting. to hear, because it seems as like there's sort of a whole spectrum of reasons that well-being overlays or impacts the way the business functions. You sort of alluded to there the support function on an ongoing basis, but also the retention or attraction of talent and leading with it when it comes to job descriptions and recruitment, which is really interesting.